Welcome back, everyone. Today we are diving deep into a high yield clinical case study on hypokalemia. This is going to be an essential review for your NCLEX preparation and your upcoming nursing school exams. So, today's our view scenario intro, clinical science, ECG interpretation, safety priority, and at last NCLEX takeaways. Let's look at our patient scenario today. Imagine you are working on the floor and you receive the lab results for your patient. Their serum potassium level comes back at 2.8 milliequivalents per liter. As a nurse, your internal alarm should go off immediately. Why? Because the normal range for serum potassium is 3.5 to 5 milliequivalents per liter. A value of 2.8 is not just low, it's critically low and requires immediate nursing action. Clinical science. Before we look at what to do, let's quickly review why potassium is so important. Potassium is the primary intracellular electrolyte in the human body. It plays a vital role in nerve impulse conduction, skeletal muscle contraction, and most importantly, cardiac muscle function. When potassium levels drop significantly, the entire body is affected. As you assess this patient, you need to watch out for three classic clinical signs of hypokalemia. First, generalized fatigue. The patient will feel completely drained. Second, muscle weakness. They might struggle to lift their arms or legs. And third, very painful leg cramps, especially in the calves. When you see these signs combined with a low lab value, you know the musculoskeletal system is struggling. ECG interpretation. Now let's talk about the most dangerous aspect of hypokalemia, its effect on the heart, because potassium stabilizes the heart's electrical system. Continuous cardiac monitoring is an absolute priority for a patient with a potassium level of 2.8. You can't leave this patient off telemetry. Take a close look at the ECG monitor. For the NCLEX, you must memorize the characteristic changes associated with hypokalemia. First, look at the T waves. They will appear flattened or even inverted. Second, look closely right after the T wave. You will see the appearance of a prominent U wave. Why does this happen? This finding indicates that the heart muscle is struggling with prolonged repolarization. If left untreated, this can quickly degenerate into dangerous ventricular dysrhythmias, which can be fatal. Safety priority nursing interventions. Alright, now let's focus on the most critical part of this case study. How to safely replace potassium. This is highly tested on exams and crucial for bedside safety. Rule number one, and the absolute most important rule, never ever administer potassium via IV push. Let me repeat that. Never give it as a direct intravenous bolus and never give it intramuscularly or subcutaneously. This is a massive never event in healthcare because a direct bolus of potassium will cause immediate cardiac arrest. In fact, it is the exact chemical used in lethal injections to stop the heart. So, how do you give it safely? Potassium must always be diluted in a large volume of IV fluid, usually a premixed bag from pharmacy. Never draw into a syringe for manual injection. Second, you must always use an infusion pump, so strictly control the rate. Never let it run by gravity. For a standard peripheral line, the infusion rate shouldn't exceed 10 milliequivalents per hour. Infusing it any faster can cause severe burning, painful phlebitis, and dangerous systemic toxicity. Also, make sure to monitor the patient's urine output. If they are not voiding at least 30 ml per hour, their kidneys can't excrete excess potassium, which can lead to the opposite problem, hyperkalemia. NCLEX-RN summary and synthesis. To wrap up our case study, remember to check your lab values, monitor the ECG for prominent U waves, and always dilute your IV potassium and run it on a pump. Master these critical safety steps and you will protect your patients at the bedside and crush your next nursing exam. If you found this clinical breakdown helpful, make sure to hit that subscribe button to the disease book for more high-yield medical and nursing guides. Thank you for watching and I will see you in the next episode.